Good day everyone, I'm Anjali Pargas, your student nurse, and for today, I will perform the assessment of the abdomen. But first, here's the equipment that I will use. I'm going to do inspection, auscultation, and the percussion or palpation. Have the patient lay on their back and I'm going to inspect the abdomen. But first, I will ask some questions to the patient. Ma'am, are you having any stomach issues?
No.
When was your last bowel movement?
Yesterday morning.
How are you urinating? Do you have any pain like while you're peeing?
No.
Do you have problems starting a stream, any discharge, like anything like that?
No.
Since female yung patient natin, itatanong natin siya kung kailan yung last menstrual period niya. Ma'am, may I ask if kailan po yung last menstrual period mo?
April 2.
Thank you. Okay, so let us proceed to inspection. So, I'm inspecting the abdomen, looking at the abdominal contour. And this patient is scaphoid, which is flat, and inward concavity of the anterior abdominal wall. And I'm also going to know if there are any pulsation. I can see the aortic pulsation in this patient's rod above the umbilicus, and looking at the belly button and checking for any mass like hernias or wounds. And with your ostomies, you want to look at the stoma and make sure it is like rosy pink color. It is not a dusty cyanotic color, and it's not prolapse. So now we're going to listen to the bowel sounds, and I'm going to listen with the diaphragm of our stethoscope. And I'm going to start in the right lower quadrant clockwise, and I'm going to listen all 4 quadrants. You should hear 5 to 30 sounds per minute, and if you don't hear any bowel sounds, you need to listen for 5 full minutes. And you need to note that these are normal, or they are hyperactive or hypoactive. So let's listen right lower quadrant. So let's listen to the right lower quadrant. Move out to the right upper quadrant. Move over to the left upper quadrant and down to the left lower quadrant. And these are normal. Now I'm going to listen for vascular sounds using the bell of the stethoscope at the aortic. Going to listen at the renal arteries, iliac arteries, and you could listen at the femoral arteries if you need it. So I'm going to listen at the aorta artery, and it is a little bit below the xiphoid process, a little bit above the umbilicus. So about right here, listening for a blowing, swishing sound that which would represent a boot. Okay, and none is noted. Then I'm gonna listen at the right and left renal arteries, which is a little bit down from the aorta location. So it's here. And then move over the left. And I'm gonna listen at the iliac, and it's in a little bit below the belly button, right here. This is iliac artery. And then listen on the other side. Now I'm going to do palpation. First, I'm going to do light palpation, then deep. And as I do this, please tell me if you feel any pain or tenderness.
Okay.
I'll start in the right lower quadrant and work her way around, and gonna do about 2 centimeters, and you're just feeling for any rigidity, any lumps, masses, anything like that. How's that feel?
Okay.
Now I'm gonna do deep palpation and gonna go about 4 to 5 centimeters. So a lot more deep than. Again, you're just gonna feel for any masses, lumps, and tell me if you feel any tenderness. Anything feels nice and soft, belly sounds that are why you do this after you listen, because you stimulate it. And that's how to perform the abdominal assessment. Thank you for watching.